50% of men between the ages of 40 and 70 had some degree of erectile dysfunction. I suspect that it's worse now with the rise in obesity and chronic disease. So what do we need to do to improve erectile function? Hi, I'm Dr. Lee Kurisko from Kurisko & Company. Erectile dysfunction is a very common problem. The Massachusetts male aging study completed in 1994 found that 50% of men between the ages of 40 and 70 had some degree of erectile dysfunction. I suspect that it's worse now with the rise in obesity and chronic disease. Erectile dysfunction is a very significant symptom. New onset erectile dysfunction in your 50s indicates a risk of a new onset heart attack or stroke within the next 2 years. So what do we need to do to improve erectile function? Well, first, you need to embrace strategies that increase blood flow. Duh, seems obvious. The main strategy to do that actually is the consumption of dark green leafy vegetables. The Esselstyn Heart Study was a study showing that you could improve heart disease, even reverse narrowings in the blood vessels, by consuming a whole food plant-based diet. Part of the protocol was that the patients had to consume dark green leafy vegetables up to 6 times per day. Dark green leafies are rich in nitrate, which is a substrate for nitric oxide. For years, it was speculated that there was an endothelium relaxation factor. The endothelium is the inner lining of your blood vessels. In 1998, the Nobel Prize was awarded when it was found out that the endothelial relaxation factor was nitric oxide. In Dr. Esselstyn's protocol, when they were put on a whole food plant-based diet, within 3 weeks, typically, a patient's chest pain was getting better, and these were people with really bad heart disease. The male patients noticed that they were starting to get nighttime erections, something that they maybe hadn't experienced in decades. Now, if you see this PET scan here, the upper image shows an area of the heart where the blood flow is impaired. Within 3 weeks on a whole food plant-based diet, consuming plenty of dark green leafy vegetables, you can see how the blood flow is starting to fill in. On this other image, which is an angiogram of the left anterior descending coronary artery in the heart, you can see that before starting the whole food plant-based diet, this blood vessel is narrowed and irregular. An angiogram is a procedure where what you do is you puncture the artery, usually the femoral artery in the groin, but you can also do it in the brachial artery in the upper arm or the radial artery in the forearm. I've done plenty of cerebral angiograms, but I've never done a coronary angiogram. The coronary angiograms are really in the turf of the cardiologists. As radiologists, we just do angiograms on simple things, like the brain. Anyways, this particular patient, after 32 months on a whole food plant-based diet, you can see that the blood vessel is now wide open. So not only do you get an immediate improvement in blood flow within a few weeks, you can get permanent resolution of coronary plaque. Other foods that are really good for production of nitric oxide include beets and watermelon. And in fact, it's been shown that with the ingestion of beets, within 30 minutes, there's an improvement in blood flow. That's why people will take beetroot powder prior to cardiovascular exercise, because it actually has been shown to have an ergogenic benefit, increasing blood flow shortly after you consume it. Now, another thing that's been shown to enhance blood flow is regular aerobic exercise. According to the Harvard Health Newsletter, men that run 2.5 hours per week have a 30% less chance of erectile dysfunction. Personally, I'm not a fan of running. I've got a beat up ankle and back, and running just doesn't feel good to me. Any type of aerobic exercise will do. My favorite is biking. Now, one thing you need to keep in mind with biking, because you're sitting on a seat with your perineum, there's pressure on those nerves to the penis. Men that bike 3 or more hours per week may actually have an increased risk of erectile dysfunction. But there's easy workarounds. If you see the bike seat that I use for my indoor biking, all of the pressure is on my ischiotuberosities, my sit bones, inside, deep to the butt muscles. My outdoor bike has a deep groove down the middle so that the pressure on the perineal nerves is alleviated. The first thing you need to do is to embrace strategies that improve blood flow. The second thing is you need to stop doing things that impair blood flow. The most important thing of all is to not consume a high-fat, standard American type of diet. Dr. Robert Vogel of the University of Maryland School of Medicine did studies feeding patients different types of meals to see what the effect was on their blood flow. The brachial artery occlusion test is a test where they put a blood pressure cuff up on your arm, pump it up so that there's no blood flow to your forearm, and leave it pumped up for 5 minutes. Sounds really uncomfortable. They then release the blood pressure cuff and observe blood flow with an ultrasound on the forearm. When students were fed a meal, a typical fast food breakfast of 900 calories with 50 grams of fat, blood flow was impaired to the forearm with the brachial artery occlusion test for up to 6 hours. The students that ate a very low-fat 900-calorie breakfast had no impairment of blood flow at all. So think about it. If you're eating a high-fat breakfast, a high-fat lunch, and a high-fat dinner, your blood vessels are getting beat up almost around the clock. It's important to realize that there are literally dozens of medications that can contribute to erectile dysfunction. A common culprit are the blood pressure medications. So if you're having issues with blood pressure and erectile dysfunction, see your doctor. Perhaps they can do a swap and give you medications that are going to have less negative effect in this regard. But keep in mind, if you optimize your diet, do some exercise, increase the production of nitric oxide, your blood pressure is going to improve, and maybe that you'll be able to cut down on your blood pressure medications and perhaps even stop them completely. Illicit drugs like cocaine and marijuana contribute to erectile dysfunction. Smoking is a problem, no surprise there, and alcohol is a problem as well. It's now generally accepted that there's no safe threshold for the consumption of alcohol. The less the better. I consume almost none myself, maybe just 2 or 3 times a year. So really, it needs to be severely moderated. So there you have it. The 2 strategies are: 1 is do things that improve the blood flow, and 2, stop doing things that impair the blood flow. Eat a whole food, high carbohydrate, low fat, plant-based diet with little or no junk food and little or no animal products. Consume dark green leafy vegetables every day for the rest of your life. Make it sure it's 1 generous serving. Now I get it, you may not like dark green leafy vegetables. I didn't like them either. A strategy that worked for me is I would eat my kale or whatever as the first thing I ate as part of my evening meal. So I was hungry and I was willing to scarf it down. In fairly short order, I started to like it and even miss it if I didn't get it. An added bonus of consuming dark green leafy vegetables on a daily basis is you're probably reducing your risk of macular degeneration, which is a common eye condition as people get older that can lead to blindness. Get regular exercise, don't smoke, limit alcohol, and avoid illicit drugs. If you embrace these strategies, it's very possible that you may have the potency of a young man, even as a senior citizen. If you like this video, please like and subscribe. Thanks for watching.